you could have mobility restriction on one side of a joint and excessive mobility on the other side. Don't just do haphazard mobility because you might irritate things if you just do that. We have to be customized and individualized in our attempt to prevent injury.
Welcome to the Movement Driven Podcast with Dr. Greg Goldberger, where we help you bridge the gap between pain and performance. Each week, we'll share strategies, insights, and real-life applications to help you keep moving and stay driven. Now, let's get into this week's episode of the Movement Driven Podcast. Hello, everyone, and welcome back to the Movement Driven Podcast. I'm Dara Sweat here with Dr. Greg Goldberger. Greg, how are you doing today?
What's going on, guys? I'm doing well. How are you?
I'm doing pretty good. We were going to continue the shoulder conversation that we started last week, and we talked a lot about the labrum and the rotator cuff and all these different things that might be the cause and the stress and yada, yada, yada. But what is the labrum and what is the rotator cuff? Let's start there.
Yeah. So I feel like in that first episode, we talked a lot about like the root causes of we need the thoracic spine, the scapula, the shoulder joint, all to kind of be having the appropriate amount of mobility and stability so that the shoulder joint itself is healthy. And then we talk about what is the rotator cuff, what is the labrum. So essentially these are structures in your shoulder joint, and they're both, their job is to provide stability. The rotator cuff is 4 different muscles and their tendons, and their job is to keep the ball in the socket stabilized when you move dynamically, whether, throwing a baseball or just getting the milk out of the fridge. Their job is to keep the ball centered in the socket. And the labrum does that too, but it's more of what we would kind of refer to as not as dynamic, right? It's just the structure that's meant to kind of like be a suction cup that stabilizes the joint and keeps that ball deeper in that socket. So simply put, these are structures that are meant to stabilize the shoulder joint. But when we have those root causes, like we mentioned, out of whack, then we start to pull and put too much stress on these tissues. And that's when they break down. And we have things like labral tears and rotator cuff tears.
Yeah. So when you mentioned the term labral tear, people I think often get scared after hearing those terms. I know that I can speak from experience with both of mine being torn, and it really not being that big of a deal, quote unquote, based off of the PT that I've done and the muscles I've built around my shoulders. But when common people who, are just regular people that maybe aren't athletes and maybe they do the gym thing, but they don't really understand like what all these things are, how to build muscles to protect other muscles and things like that. When they hear labral tear or impingement, what does that mean? Because it sounds scary. So what do those things really mean?
Yeah, so let's take it one by one. So we'll talk about the labrum first. So when you have a labral tear, that can mean a number of things. So like everything is on a spectrum. Labral tear itself has 4 different grades, grade 1, 2, 3, 4. And usually, the higher the grade, the worse or the more severe the tear. But it also has things to do with some of the grades have to do with bicep tendon involvement. So the biceps tendon blends in with the labrum. And if you have labral tears, you can have biceps tears. But essentially what this is you can have little tears or little fraying in this actual tissue, which makes it less stable, right? It's not going to do its job. And if you have a tear, just like you have a tear of your skin, which is a cut, right? Tear can be very minimal in terms of the grade of it. You can have a minor tear or a major tear. But if you have a small tear, then you're going to have some pain and you're going to have what we refer to as quote unquote instability. And that requires rehab to kind of stabilize the joint and strengthen around so that you can survive XYZ activities, even though you have a labral tear. Now, in some situations, the labral tear is too extensive and surgery is absolutely necessary, especially if you're a baseball player and you need to throw 90 plus miles per hour in college next year. Like then you need a labral tear. But if you're just trying to, toss the ball with your kid once a week, you might not need that same surgery kind of thing. Then we bring it to impingement. Impingement is kind of focusing more on the rotator cuff. So impingement, rotator cuff tendinopathy, tendinitis, rotator cuff tear. I'm going to kind of all group that into one category. So stay with me. When we have the poor posture we've talked about in the last episode, right? When the shoulder blade is tilted forward, we're in that poor posture sitting down, and our mom's telling us to sit up straight. What that's doing is essentially the top of your shoulder blade is coming down on the one of the main rotator cuff tendons called your supraspinatus. And this tendon is getting pinched upon. And it's decreasing the space in which that rotator cuff likes to operate, and that is impingement. What happens when we get into a poor posture, we lift up, we are further decreasing that space. We're pinching that tissue more. We are impinging that tissue more. So that is rotator cuff impingement, or what we refer to as subacromial impingement. Now, what I see is the impingement tends to turn into some sort of tendonitis, which we're really calling tendinopathy. Don't worry about it. We're just not seeing inflammatory markers on MRI or under a microscope. So they changed the terminology. Don't fret with that one, folks. All it is a degradation of the tendon. And again, just like with the labrum, we can have little tears or we can have major tears. When you have a tendinopathy, you have some little tiny fraying that you can only see under a microscope already occurring. And we have to repair that tendon by loading it appropriately and rehabbing it appropriately and addressing the root causes that led us there. Now, if we don't address this, or if we have some type of traumatic injury, it can turn into like a partial tear or a full rotator cuff tear, which even partial tears, sometimes like you have a labral tear, you don't need surgery. Even sometimes partial rotator cuff tears don't need surgery. Full cuff tears usually require surgery depending on your function and how old you are and things like that. But did I confuse you with that? Was that good, Dare? Did I simplify that? Rotator cuff,
Yeah.
okay.
Yeah, no, I think that was great. And that leads me to my next question, especially you mentioning how, a cut and a tear, could be different and it
Yeah.
doesn't always mean surgery. So why does the imaging not always match up with how someone feels or performs?
Yeah, I think this is like true and not just in the shoulder joint, but anywhere. Like an image is a like an MRI image is just a piece of my diagnostic puzzle that I'm putting together. And it's a useful tool and it's usually pretty darn accurate. But I've seen a lot of people like for instance, you might get some I don't want to use you. I'm gonna knock on wood right here. I'm knocking on my skull. We're not jinx you. But if you hurt your shoulder doing an overhead lift sometime in the next couple of months and you went and got an MRI, it might only show a labral tear. And if you just went by that MRI, it'd be like, oh, your labrum torn, but you might have some rotator cuff thing that's just not showing up on MRI. Like you might have impingement that's not bad enough to be picking up in any inflammation. So that's where the tests that we do in therapy and our expertise come into play. We are good at diagnosing the issue and identifying what's the actual tissue involved in terms of what's the diagnosis and then what's the root cause that caused that, so we can address it all at once. And so that's why the MRI is just a piece of the puzzle. You might have a labral tear. It doesn't mean that that's causing your pain today sitting in my office. So we use it, but we don't rely wholeheartedly on it.
Yeah. And I think this next question is a good one for me as well, because I think that I know that there's a difference, but just to really define it, what is the difference between there's irritation, there's injury, and dysfunction? So I coach CrossFit on the side, and there's sometimes when people come in and they're like, oh, I got this thing, it's like irritating. And I'm like, okay, well, is it irritated or is it injured? Or is
Right.
like, what
Are you hurt or are you
Yeah.
injured? Yeah, that's
Yeah.
kind of like
Yeah.
where the sports side of it comes in. I would say like if you're irritated and hurt, it's something that you're not going to probably make worse, even with some repetitive stress and going through your workouts or your normal activities, versus if you're injured. Now we're at the point where we have to change activity, at least in the short term, to make sure we're facilitating the healing process the right way. I.e., if you have a shoulder or rotator cuff impingement, that it might not take you out of lifting overhead and you feel fine doing that. But if now we're at a rotator cuff tendinopathy and every time you lift overhead it hurts, well, we're not going to lift overhead for a couple of weeks, and we gotta give it some time to heal the right way and do some other things to facilitate the process. So that's how I delineate that. And then dysfunction comes into where it's not just my workouts. It's like I can't do I can't do my daily activities, which we refer to as ADLs, activities of daily living. And that means your quality of life starts to truly be affected more than just from a hobby standpoint. It's now you can't function as an employee or as a father or a husband or a mother or wife or whatever it is. So that's kind of how I delineate and separate those three terms.
Yeah. Yeah. I think it's really important for people to know that two people can have the same MRI results and have totally different pain levels or mobility. And, movement-based therapy is so affected compared to just resting or focusing on that diagnosis itself. So, when you're up against a case or two cases or whatever of like this, why does taking ownership of recovery look different for someone dealing with a shoulder diagnosis or any diagnosis, really?
Well, I think with the shoulder joint, if we stay in the shoulder joint, because of the complexities that we talked about in part one, it's so important to get a true customized program. Like, you can't do cookie cutter PT for the shoulder because it's so hard to explain, but even within one patient, like, you could have mobility restriction on one side of a joint and excessive mobility on the other side. And this is something we'll talk a little bit about in our next episode, actually, in terms of like for myself being an overhead thrower, the way that I've thrown over and over again, I've now developed a torsion of tightness around my shoulder joint. And so you can't just flat out say, work on your mobility. I have excessive mobility in half my joint, and I don't have enough mobility in the other. So I have to be very specific of how I address my shoulder mobility issues to prevent my shoulder from being into rotator cuff or labral tear, territory 10 years down the line or whatever it is. So how I would address my shoulder versus your shoulder might be completely different, even from a preventative standpoint. That's why it's so important to go in and get a movement assessment. And if you have some things creeping in, or if you don't, somebody like us at Movement Driven, we can look at everything and be like, your shoulder's not moving well in this one direction and moving well in these 5 other directions just fine. Don't just do haphazard mobility, because you might irritate things if you just do that. We have to be customized and individualized in our attempt to restrict or to prevent injury. So how do I tell people? You have to come in and get that assessment so I can tell you exactly what you need to do.
Right, exactly. Yeah. So, all right. Well, thanks so much, Greg. I think this was an awesome episode with a lot of information. And the main thing that we want you to take away is not letting your diagnosis define you. Movement is medicine, and it starts with understanding your body. And our PTs here at Movement Driven can really help you do that, regardless of what the MRI says, or, obviously you want to listen to your doctor to an extent, but you can still get through without having to have surgery or, go through all these things. Manual therapy, dry needling, all those other things that we offer here at Movement Driven can really help you with that.
Yeah. And I'll just if I could wrap it up real quick with, sometimes surgery is inevitable and is absolutely necessary. Like, there's obviously those cases. I always tell people, get a second opinion if you think you're not at that level. And then, if one doctor is saying something different, then you go the conservative route and we see what we can do to prevent that. But the shoulder specifically, it's like we talked about, it's so complex, and there's so many different variations of what we see just in like the rotator cuff tear world. So get a couple of different opinions and get a movement expert, get their eyes on you, so we see what the root cause is.
Yeah. Awesome. Well, thanks, Greg. See you on the next one.
See you guys.
Thanks for tuning in to the Movement Driven podcast with Dr. Greg Goldberger. Want to see how we're helping people in Jacksonville bridge the gap between pain and performance? Head on over to movementdriven.com. Until next time, keep moving, stay driven.